Sure. So this was a randomized phase 3 trial comparing the U2 combination of Umbralisib and Ublituximab to Chlorambucil and Obinutuzumab. This is for both previously untreated patients and patients who had previous therapy. And what we found was that there was a much higher response rate, progression-free survival compared to the control arm of Obinutuzumab and Chlorambucil. I think one of the other really important findings of the study, this is the first PI3Kδ inhibitor that really has been able to successfully be given in the frontline setting in patients with CLL. So there was some adverse events that you associate with PI3Kδ inhibitors, most notably diarrhea. It was a little bit worse in the frontline setting than it was in the relapse setting, but all in all, pretty manageable. I think that ultimately this will probably not. It's great that we have another treatment option for patients. It shows that it's a well-tolerated PI3Kδ inhibitor, but that space is really pretty well captured right now with in the frontline setting, either with Ibrutinib or venetoclax. But this does allow, for one another treatment option. There are certainly patients that are not candidates for one of those two drugs. This opens up another treatment option for patients if it ultimately gets approved in that setting.